Hi, I'm Dr. Victoria Dooley. I'm a practicing family medicine physician. I'm a healthcare activist, and I'm extremely passionate about eliminating health disparities. So I'm going to spend a little bit of time discussing Medicare for All, racism, and health disparities with you today. I'm so delighted for this invitation. The fact is racism shortens the lives and harms the health of Black people by promoting genes that lead to inflammation and illness. This is not a hypothesis, this is a fact. Scientific evidence proves it. So when you hear facts like African Americans or Black people have the highest incidence of hypertension in the world, and then when people say, well, maybe it's because of their genes, it's really frustrating to me, because we kind of got to go back to which came first, the chicken or the egg argument. Were we just born with genes that predispose us to hypertension? No, it is the systemic and institutional racism that changes our genes to predispose us to hypertension. And Black women specifically have the highest incidence of heart disease, all forms of heart disease in the country. They have higher rates of heart disease than Black men, white women. And when you think about all the stressors that we have to carry as Black women in this country, it doesn't come as a surprise. When I first heard the statistic as a Black woman, I was a little bit shocked. I couldn't believe it, because neither myself, my mom, or my sister have any form of heart disease. But as I started being a practicing physician, and I keep seeing all these young women in their 30s and their 40s and their 50s, beautiful Black women who had heart disease, the statistic started to come to life to me. Over 50% of Black women over the age of 19 have some form of heart disease. And so as Black women, what do we face? We go to work, we get paid 60 cents on the dollar. We are the most college degreed women in the United States, but we also incur the most student loan debt. When we go to work, we're policed for stupid stuff like our hairstyles. And not only do we have to worry about ourselves as Black women, but we have to worry about the Black men in our lives that we love. Our sons, our husbands, our uncles and fathers and loved ones. We have to worry about them being gunned down by the police and hunted by the police. And I use that term intentionally. So we have all these things to worry about. And not only that, right? There's this idea of a strong Black woman. And Black women absolutely are strong. But this stereotype of the strong Black woman makes us feel like we don't have the right to feel depressed, anxious, stressed, because that's a sign of weakness. So when you think about all we have to experience as Black women, it really makes sense that we are more likely to have broken hearts. And Medicare for All won't cure racism, right? But neither did freeing the slaves. Nonetheless, I'm glad that it happened, so I can sit here today as a free-ish Black woman. If your litmus test for whether or not something is a good policy is whether or not it cures racism, well, then you're going to be extremely disappointed all your life, because there is no one way that we're ever going to cure racism. But what Medicare for All can do is to put us on an even playing field. And the Medicare for All that I talk about, as part of the law, it makes implicit bias training mandatory. It will be mandatory for all providers to learn how to provide culturally competent care. It would allow patients to sue providers who did discriminate against them because of the color of the skin, who assumed that their pain wasn't real simply because doctors don't believe Black women when they have pain complaints. They believe our skin is thicker and that we have, less pain. The Medicare for All that I'm talking about is going to allow things like transportation to be covered, because too many people of color and people of low income have difficulty getting to the doctor because they don't have reliable transportation, or they might not live in an area with good public transportation. It's going to fund telemedicine. That's something private insurance companies weren't really doing universally until this pandemic, right? Because you have people who live in rural areas and their nearest doctor might be an hour away. So it's going to fund telemedicine for these communities, and it is going to fund new positions within the healthcare system, cultural competency care liaisons, to help make things more equitable. And it's going to bring down costs. It's going to bring down prescription costs. You're going to have no copay when you go to the doctor or the pharmacy or get your labs. Everything's going to be covered in full. And this is huge for everybody. But because people of color are more likely to disproportionately have diabetes, very difficult to control high blood pressure, it's going to help us a ton more, because we are more likely to have conditions that oftentimes can only be controlled with expensive medications like insulin. So some Black people die because the healthcare provider didn't treat them with dignity and they had implicit biases, but some die because they could not afford insulin. This is people of all colors, but Black people are more likely to have diabetes. So just being able to get all your medicines covered in full is going to be life-changing for a ton of people, especially communities of color. And with every effort that we've made to ensure more people in this country every single time, whether it be expanding the Affordable Care Act or expanding Medicaid, every single time, there is still a disproportionate amount of low-income people of all colors, Black and brown people, who are still left uninsured. Every single time. Call me a conspiracy theorist, but I do not believe this is a coincidence. It is intentional. They know that with all of these policies, there's still going to be a disproportionate amount of people of color who are left uninsured. And there's an easy solution to this problem. A grade schooler could figure it out. If you have some people who live in the wealthiest nation in the world who are uninsured, what do you do to solve that problem? You provide health insurance to them all, guaranteed as a human right. And so the solution for people of low income is not Medicaid. Medicaid is a great program. I'm glad that we have it. I feel saddened for people who live in states that didn't expand it. So right now, it's the best that low-income people have, right? But Medicaid is this scarlet M. It tells everybody that you are poor or low income, and nobody should be able to guess what your household income is simply because of some words on your card. And it restricts you. The patients that I cared for in Flint who were subsequently poisoned by lead water, yes, they can go to the doctor, but if they have Medicaid, there are a lot of doctors who don't accept Medicaid. There are a lot of medications that Medicaid won't cover. So they have health care, but it's restricted simply because of the word on their health insurance card. And that is not right. So in order to get healthcare providers to treat patients equitably, we must allow healthcare providers to treat patients equitably. Well, what does that mean, Dr. Dooley? Right now, doctors can't give patients the best care because we have health insurance companies that tell us as doctors what we can and cannot do. So you might have a patient and you might think one particular medicine is the best medicine for them, but if their health insurance doesn't cover it, you can't give that to them. So I think it is very important for us as a society to have one single payer where we can treat all patients fairly and equitably, where we as healthcare providers don't have to consider if this patient will be able to afford this medication. It's important to get healthcare providers in this mindset as a step towards eliminating health disparities and getting them in the mindset of treating all humans as humans and not just looking at their color. So right now, they look at the health insurance card to dictate what kind of care that they can give. And we need to eliminate that obstacle so that they can treat all patients fairly and then train them to eliminate implicit biases and move past individuals' color of their skin. So where do we go from here to get Medicare for all? We need to keep having discussions like this. We need to keep putting pressure on elected officials. We need them to know that if you run on Medicare for all, we are going to expect you to deliver and fight for it like hell, because it's literally a life and death situation. And if they don't, they need to know that they are going to only have one term. So America's healthcare system is neither healthy nor caring. It is not going to be easy to transform it because of these big muddied interests, but there is too much at stake, and we must continue to fight to not die because we are unfortunate to have an illness that we cannot afford. Thank you.